Hi, my name is Olivia Shasho, and I'm going to be doing the validation for setting up a sterile field and doing a wet to dry dressing. So when I have spoken with the patient. I came in a little earlier. I asked about their pain. They stated their pain was a 7 out of 10, so I did give pain meds as per doctor's orders, and now I'm back. And the patient stated their pain was a 3 out of 10. So we're gonna begin the wound dressing. We're gonna do our steps. So we're gonna check physician's orders. We're gonna wash our hands, identify the patient using asking for their date of birth and name and identifying it or checking it against the wristband. Identify myself. We're going to explain the procedure and provide privacy, which I have with the thing. So to begin, I'm going to take, I've already washed my hands, so I'm going to put on my clean gloves, and we're going to take off that wound dressing. So I have the wound here, and okay, so when we look at the wound, we're going to assess it. Look for or assess the length, depth, redness, any drainage, odor, purulence, and what the patient says as well. So we've taken off the old wounds, assessed it, looks not too much drainage, so it's good. And we're going to now set up the sterile field. So I'm going to remove these gloves. I have some hand sanitizer, so I'm going to hand sanitize. And we're going to put on our new gloves to set up the field. Okay. First is the sterile drape. So when setting this up, you have a 1-inch border to touch on the outside. So I've stayed within that 1-inch border, and the white side does go up. So we have that. We're gonna now move onto our basin. So the first, you're gonna open away, and you don't want to do this over the sterile field. Then to the side, and being careful, I'm gonna drop that on there. Okay, now we're gonna open up our gauze and drop that on as well. We need quite a few gauzes as it's kind of a deep wound. And another thing to keep in mind is always keeping everything sterile above your waist. So if you notice the tables are above my waist, the patient is up nice and high as well. Okay, just a couple more. Okay, so last gauze, then we're going to open up the ABD. We're going to pour in our sterile saline, which we've checked the expiration date on everything, and everything is undamaged and has the correct expiration date. Lastly, the ABD. Okay, everything landed within our not touching the 1-inch border. We have our sterile water, or saline rather. I'm gonna pour it. Okay, great. Another thing to make note of is never turn your back on the field. And so now that it's open, you can never turn your back. If you do, you always have to have someone looking. So I could ask a fellow nurse to come and watch my field, but once you turn your back, it's contaminated, considered contaminated. So we are, and I also have my tape ready for when we put the new dressing on. Okay, so we're gonna begin. To begin, I'm going to wash my hands, or use my hand sanitizer, which I have on me. And I'm going to put my sterile gloves on. And I'm going to do this on this table so that I have enough room, and so that I can keep that in my line of vision, making sure the patient doesn't touch it, which I've explained to them not to touch it. Nothing lands on it like a fly or anything. So we're going to open this up like so, and start with the left hand. So I can use the right hand touching the inside of the glove. Okay, so I'm gonna, now that this hand is sterile in the glove, I can use it to better get this one on. Okay, wonderful. And then I can roll that one. So we have this, I can now touch in the center of this wrapper, as the center is not sterile. Or sorry, the center is sterile. Okay, so we're gonna begin. So to begin, we're going to clean the inside of the wound. This is going to be my sterile hand. This is going to be the hand that touches the patient. So we're gonna take a gauze, moisten it, dry it, and pass it off without touching. We're gonna do one swoop in there. Once it's used, garbage. We're then going to clean the sides. Again, each with a sterile. So I'm going to clean the edge. Clean this edge, making sure not to push any debris inside the wound. And now we're going to pack it. So I'm going to take a piece of gauze, wet it, and we're going to pack it in there, making sure it's touching all the sides. Okay, nice and we're going to do one more. Okay. So we have it packed. We're then going to take a couple dry 4x4s, place it on there, Then we'll be using the ABD. And this is the last thing that goes on, so I can use both hands for this. And it'll go on right like that. I'm then going to use my tape to tape the dressing on. And I had the tape laid out earlier. I have my piece of tape that has my initials, the date, and the time that the wound was changed. So now we are going to dispose of everything. I'm going to wash my hands, remove my gloves carefully. We're going to document the procedure that was done, how the patient tolerated it, and any drainage information about the wound, my assessment, and we're going to let the patient resume their day and their rest. And of course, bring the side rail up for the patient and lower the bed down to the lowest height and give them the call bell. Okay, but that is all, so thank you.